Have you ever had one of those colds that just refuses to leave? You know, that deep, nagging congestion that feels like it's moved in and started redecorating your sinuses? Well, that's exactly the kind of clinical mystery we're going to crack open today, the case of acute bacterial sinusitis. Look, most of the time, a cold is just a cold, right? It's viral, your body beats it up in a week or so, and you get on with your life. But every now and then, that initial inflammation creates the perfect storm for bacteria to crash the party. And that turns a simple illness into something totally different. So how on earth do you tell the difference? Every good investigation starts with a story. So let's begin by meeting our patient and hearing what brought her into the clinic in the first place. Okay, so our patient is a 32-year-old woman. She's dealing with facial pain, a headache that just won't quit, and that telltale purulent nasal discharge, which is really just a fancy way of saying thick, gnarly, colored mucus. But honestly, the most critical piece of info on this slide is the timeline. 10 days. And boom, right there, that's our first major clue that this might be more than just a garden variety virus. All right, so we have her story. Now it's time to play detective and look for some cold, hard, objective evidence. Let's get into the investigation. The physical exam immediately reveals tenderness right in her cheeks, just below her eyes. That's a direct hit on the maxillary sinuses. And when we take a look inside her nose, the passages are all red and swollen. These aren't just things she's feeling. These are clear, physical signs of some serious inflammation. And we've got a fever. 100.4 degrees Fahrenheit. This is the body's alarm system, and it is blaring right now, signaling that it's in the middle of a fight with an infection. So, the investigation goes even deeper, all the way to her blood work. Her white blood cell count comes back at 12,000. Now, you might be thinking, is that a lot? Is that normal? What does that number actually tell us? Well, let's put it into perspective. So, the normal range for these little infection-fighting soldiers is between 4,500 and 11,000. Our patient's count of 12,000 is clearly elevated. It's basically proof that her immune system has called in the cavalry to battle whatever's going on. And here we go. The final pieces of the puzzle just snapped into place. A CT scan confirms significant mucosal thickening, even more proof of all that inflammation in her sinuses. And then, the smoking gun. A nasal swab identifies the actual culprit. In this case, it's Streptococcus pneumoniae. Now, it could have been other bacteria, like Haemophilus influenzae. Those are common suspects too. But with this, we have a crystal clear picture of what we're up against. We've got the story, we've got the physical signs, and we've got the lab results. All the clues are on the table. It's time to put all the pieces together and officially give this thing a name. The diagnosis is acute bacterial sinusitis. So here's how this usually goes down. You get a regular old viral cold, and that causes inflammation that blocks up the natural drainage pipes in your sinuses. This traps all that fluid and mucus, creating a stagnant little swamp where bacteria can just move in, thrive, and multiply. And that right there is your secondary infection. So let's just run through that checklist one more time, just to be absolutely sure. Duration of symptoms over 10 days. Check. Key signs like purulent discharge and a fever. Check and check. And the lab confirmation with that elevated white blood cell count? You bet. It is a classic textbook presentation. So, we've solved the what. We know what she's got. Now, we face the most important question of all. What's the next move? What do we do for our patient? So what's the right call here? Do we target the inflammation with corticosteroids, go straight after the infection with antibiotics, or maybe just manage the symptoms with decongestants and saline rinses and let the body do the heavy lifting? Or do we simply wait and see? What would you do? All right, moment of truth. Let's solve this final part of the puzzle. It's time to reveal the correct treatment and, more importantly, the clinical thinking behind it. The correct answer is B. Oral antibiotics. If you chose that one, you're right on the money. But the really big question is why? Why is it the only appropriate choice here? Let's just break this down. Antibiotics directly target and eliminate the root cause, the bacterial infection. All the other options are just supportive care. Corticosteroids, decongestants, saline irrigation, yeah, they can help you feel better, they'll reduce swelling and congestion, but they won't kill the bacteria. And as for just observation, not an option here. With clear evidence of a bacterial infection, waiting around risks potential complications, like the infection spreading, and we definitely don't want that. So when you boil it all down, the whole case really hinges on this one critical point. telling the difference between a persistent bacterial infection that needs intervention and a self-limiting viral cold that's just going to resolve on its own. And more often than not, the single most important clue is time. That duration is the key differentiator. And that pretty much solves our case. But I'm going to leave you with this final thought to chew on. What if our patient's symptoms had only been around for 5 days, not 10? Would the treatment plan still be the same? It's something to think about. Next time you have a cold that just won't quit, now you'll know exactly what clues to look for.